Post-operative atrial fibrillation, or post-op AFib, is a common complication after cardiac procedures associated with perioperative complications and mortality. Although the etiology of post-operative AFib has been attributed to perioperative inflammation, adrenergic activation, and oxidative stressors, whether an underlying genetic susceptibility exists has been unclear. Given the unique stressors of surgery, we hypothesize that new-onset post-op AFib would be associated with genetic variants distinct from those previously associated with atrial fibrillation. The UK Biobank compiles phenotype data, genotype data, and inpatient hospitalization records for over 500,000 individuals. We stratified patients by presence of new-onset AFib after cardiac procedures, excluding patients with preoperative AFib. Categorical variables were compared using chi-square tests, and Mann-Whitney U-tests were used for continuous variables. Genome-wide association analysis of postoperative and non-operative patients was performed with Plink2. We identified 279 of 33,780 patients diagnosed with new-onset post-op AFib after cardiac procedures. Those with post-op AFib were more likely to be male and have preoperative hypertension, renal failure, congestive heart failure, and COPD. Patients undergoing CABG, aortic, and mitral valve replacement were overrepresented in the post-op AFib cohort, while PCI and angioplasty were underrepresented. Genome-wide association identified variants at chromosomes 6 and 8 associated with post-op AFib. These loci were not associated with AFib in patients without surgery. In conclusion, post-op AFib is associated with distinct genetic variants compared with non-operative AFib, suggesting a unique underlying predisposition to post-op AFib in the setting of perioperative stressors from cardiac procedures. In the future, we plan to validate our findings in other data sets containing postoperative inpatient data. We will generate and validate a polygenic risk score developed on patients with atrial fibrillation in postoperative atrial fibrillation patients. And finally, we will functionally characterize the role of DLGAP2 in the development of postoperative AFib.